Hey everybody, we're talking a little bit more about non-surgical treatment for hammer, claw and mallet toes because there's really quite a few that we can do reasonably effectively. So let's dive straight in. Footwear and lacing is really important. So when we talk about footwear, we talk about a wider, a deeper toe box, potentially an extra length if there's concerns with the length, and our lacing. So, you know, a loop lock lacing technique is going to really stop that foot from moving forward and causing some of those shear forces on potential corns or deformities that are present. We talk about orthoses and unloading or offloading some of those areas that are of concerns, and even just using a metatarsal bar or a metatarsal dome to really effectively unload some of those metatarsals can be quite instrumental in reducing some of those the symptoms associated, particularly in reducible non-rigid hammer toe deformities. Now, we talk about our Otoform or our customized silicone props, we talk about splints, we talk about taping, and all of these are about putting dividers in between the toes and correcting the position. Particularly if there's a plantar plate tear, and if it's acute, a great time to put it into place. And there's some splints that we can use here, but even just a really simple ribbon of tape around that toe, bringing that toe back down into that plantar flexed appropriate position from the MTPJ is a really good way to prevent concerns in the longer term and symptomatic relief in the short term as well. Now, to reduce these concerns from being ongoing, some intrinsic strengthening is really good. And what I'm talking about there is like things like picking up a tissue or a sock with your toes. And that's just going to strengthen all of those small muscles within the forefoot, which will hopefully offload and strengthen, decreasing our progression rate of these hammer toes, etc. For those that have got, quite concerns, we can do a little bit of muscular relaxing, and we can do that through a few different ways. One of those is by dry needling some of those intrinsic muscles, like our interossei, like our lumbricals. And then in the way that, in case that does fail, and we're finding particularly in patients like that we've got here, that is post-stroke, some botulinum toxin or Botox injections can really help to release some of those muscles and put our patients in a better position to reduce the deformity. Now, having a look at all of these options is really important. Seeing if we can exhaust that conservative before potentially looking at a surgical option is a great way to go. But hopefully we've given you a little bit of information here. Hit the subscribe button to see a little bit more. Otherwise, look at some of our videos right now and the conditions that we've gone through. Cheers.